Hello, my name is Vicky. I'm going to be your nurse for the day. Can you state your name and your date of birth?
Yes, ma'am. Grayson Benoit, March 19th, 1997.
Alright, we're going to do a physical assessment today, but first I'm going to wash my hands.
Okay.
Okay, we're going to start off with your skin. Are there any bruises or scars that you're aware of?
No, ma'am.
Alright, we're going to go onto your nails. Make sure there's no clubbing. Alright, and then we're going to do your peripheral pulses, which is your brachial and your radial. And then again. Okay, now we're going to move on to your head. Have you ever had any concussions or anything like that?
No, ma'am, I have not.
Alright, now we're going to move on to your face. So we're going to test your facial nerve. I need you to smile, frown, and puff your cheeks. Alright, now we're going to move on to your trigeminal. Just need you to clench your teeth together back and forth. Alright, I'm going to try and separate your jaw, but it should not separate. Okay, now we're going to look at your temporal arteries. Okay, now we're going to look at your neck. Make sure everything's symmetrical. I want to check out your carotid arteries. Now I'm going to listen. Now I'm going to check out your lymph nodes, and we're going to start with your preauricular, your postauricular, your occipital, your jugular digastric, your superficial, your deep cervical, postcervical, your submandibular, submentals, and your supraclavicles. Okay, now I'm going to check your spinal accessory nerve, and I just need you to show your shoulders against my resistance. Alright, cool. Now I'm going to move on to your eyes, and I just need you to follow my light. Okay, look directly behind me, and we're going to do that again. Check your accommodation. Alright, go down. I'm going to move on to your ears. Do you have any tenderness or pain as I feel?
No, ma'am.
Alright. Do you ever have any extra built up wax whenever you clean your ears?
No, ma'am.
Alright. Now we're going to do the whisper test. I'm going to whisper in your ear and you just tell me what you hear.
Super.
Okay, cool. And now we're going to move on to your nose. I'm going to check your maxillary sinuses and your frontal sinuses. You have any tenderness? Alright. I'm going to check inside of your nose. Do you ever get any irregular drainage from your nose?
No, ma'am.
Alright. Now just tell me what you smell. This is checking your olfactory nerve.
Smells like chocolate.
Alright. Now we're going to look inside your mouth, so just say ah. Have you ever had any cavities? Alright, lift up your tongue. Alright. Now we're going to check your gag reflex. Say ah. Alright. Now I need you to repeat the words tight, light, and dynamite.
Tight, light, and dynamite.
Okay, cool deal. Now we're going to move on to your thyroid. So I just need you to tilt your head slightly to the right. Swallow for me. And tilt it to the left. Swallow again. Alright, good deal. I think that covers everything. So thank you for your time.
Yes, ma'am.
All right, so for this patient, the patient was oriented to the person, time, and the place. There was no signs of malnutrition, no physical deformities or assistive devices were used. The patient has a steady gait and posture. The patient often smiled and comprehended well during the assessment. He had very well personal hygiene. His skin was dry and intact. His nails were rounded with no signs of clubbing. His peripheral pulses, brachial and radial, were equal and thready. The head and face was symmetrical. There was no lesions noted to his scalp. His hair was thin and dark brown. His facial nerve was intact. There was no pain reported when assessing his sinuses. His trigeminal nerve was also intact. His temporal artery was palpable. His neck was symmetrical with no lumps. All lymph nodes were palpable with no abnormalities or swelling. Carotid arteries were equal and bounding. The trachea was midline. His spinal accessory nerve was intact. Perla was noted to both eyes. The oculomotor, trochlear, and abducens were all intact. His corneas, conjunctivas, and scleras were clear with no swelling. His irises were hazel to both eyes. His ears were equal bilaterally, and there was no tenderness on palpation. His acoustic nerve was intact along with the whisper test. His nose was midline with no reported nosebleeds. There was no pain noted to palpation of his sinus. The olfactory nerve was intact. There was no obstruction present when patency was tested. The nasal mucosa was free of lesions. His septum was midline. The lips and buccal mucosa was free of lesions. His teeth were intact with no sign of decay. There was no redness noted to the gums, the tongue, or the palates. The tonsils were clear of inflammation and patches. His glossopharyngeal and vagus nerves were also intact. His voice was smooth with no strain. His hypoglossal nerve was intact, and his lingual speech was clear and distinct, and his thyroid gland was palpable with no bruits heard on auscultation. Thank you.